It's Reefer Madness, the podcast, with Trevor and Kirk.
Kirk, we're back.
Hey, how's it going, Trevor?
Good. And now we don't usually sort of put this in time context for people because, who knows when they'll be listening to it. But Kirk, what literally just happened that kind of delayed our Zoom call?
Canada just beat Finland in the Olympic bronze game, I guess. They're now
No, semifinals.
Yeah, but in this game sends them to the gold medal or the bronze game, right? So they're going into the gold game.
They qualified for the championship game, but it was a bit of a nail biter, and some of us who are working just got to see blips on the internet, and some of us who are at home were saying, "Well, we can't do a Zoom call yet. It's the third period, and they're down 2-1."
Yeah. Third period.
That's as good. That's as good an excuse as any. Okay.
Well, I was going to say, only in Canada can you delay stuff for a hockey game. Sort of like soccer.
Absolutely. So we should go back to I'm Trevor Sheffield. I'm the pharmacist. Who are you?
I am Kirk Nyquist. I'm the registered nurse. We're Reefer Madness, the podcast. And you brought back an old friend that we had on a few episodes ago.
Yeah, we've got David Traylor. He's still from Golden Eagle Partners. And because he's a really interesting guy for many, many reasons. And we're too busy talking about other things. I'm just going to do a really quick blitz through his, we'll call it resume, just so people get an idea of all the stuff he has done. Founder and managing director of Golden Eagle Partners, that's what we've talked about before. First investment banking firm to look at cannabis and psychedelic sectors since 2013. Chief business officer for Cerna, one of the first public companies in the world in cannabis. He was managing director, senior VP, senior associate at some other investment banks, looking at life science, healthcare. During his banking stuff, he looked after public biotech, medical devices. He had 15 years actually in biotech companies before that, because everyone's got to have a really interesting thing in the backstory. He was actually a professional lacrosse player back in the late 80s. And lest you think he's just a jock, David got degrees in biochemistry, molecular and cellular and developmental biology, and he has an inventor and patents, inventor on 3 issued U.S. patents. So he's done a lot both in biotech and in, we'll call it the investment banking world, and has sort of specialized in cannabis and psychedelics for the last 10 plus years. So, but today we're bringing him in on something called Skunk Works, one of sort of his latest projects. We'll let him explain that. But any other things we need to talk about, David, on the front end? I can't hear you, Kirk.
Sorry about that. I had myself on mute.
I can hear you now.
I don't think so, Trevor. I think let's just jump into listening to the conversation. You guys are sort of, again, having a discussion. You go pretty much all over the place, and a lot of the things that he mentioned really came in the last 5 or 10 minutes of your conversation that I think I want to talk about. But let's just go into it and see where it takes you.
Okay. And record there. That seems to be happy too. Okay, everybody, we are back on the line with David Traylor, David of Golden Eagle Partners. We have chatted with him before, and we're going to ask him a little bit about what's going on with Golden Eagle and cannabis lately, but there's new exciting things that him and his team are involved in, and we're going to let him talk about that. But hi, David, thanks for being on the podcast again, and tell us a little bit about Golden Eagle and cannabis and investments going on lately.
Yeah, thanks, Trevor, and thanks everybody for listening, and happy Monday, or whenever you may end up listening to this. But we founded Golden Eagle Partners. We had our 12th anniversary for North American cannabis last December, a couple months ago now. I can't believe how quickly it's going. And then we had our 10th anniversary for international cannabis just last month of January, and our 5th anniversary for psychedelics. And this is all for Golden Eagle Partners. So we're certainly one of the first investment banks to do cannabis and work in psychedelics. And as you pointed out, yeah, the last few years have not been easy. As a matter of fact, most of our competition in the investment banking side have exited. I think the main guy that we knew who was global head of cannabis at Canaccord is no longer doing cannabis, at least the last time we checked a couple months ago. Certainly, Cantor Fitzgerald isn't doing it anymore, and Cowan's out of it mainly because TD bought him out right from Canada and didn't want anything to do with it. Roth Capital's out of it, so maybe they're smarter than we are.
Well, obviously we're biased and so is our audience, but we think cannabis is still an exciting place for people to be involved in. So
Yeah,
hopefully you're on the right side and they're on the wrong.
right. Well, I mean, the one thing, and this gets kind of on the way to, I guess, a good segue onto the Skunk Works is the fact that, there's been very little capital, active capital in the space. A lot of, the capital went in to some of these public companies in 2018, 2019, whether they're in Canada, US, wherever. And then, as you know, those valuations have stayed pretty low. And as a result, a lot of these funds that put money in haven't been able to exit a lot of their investments. And and you really need to exit and have some pretty good returns to be able to raise another fund, right? And so capital's been pretty problematic in cannabis. And I should have started off this, by the way, too, Trevor, that being a biochemist, to me, cannabis is the genus, which it is. And so I don't like to refer to marijuana as cannabis and cannabis marijuana. To us, cannabis is a genus. So that's the over large category. And underneath that, we have THC plus, or people call that marijuana, and THC minus, or people call that hemp, or something in between where you do certainly have products, THC plus and THC minus, where you have a D9 product with a CBD product, right? That, for example.
Yeah,
But
and
the
we
one,
we've mentioned before, we really like your nomenclature, the THC plus, THC minus. That's come up more than once. Remember when David Traylor, because it's a nice way to explain it to other people. Like you said, people get hung up on the word marijuana and hemp, and THC plus and THC minus is straightforward and easy to understand.
well, yeah, the other thing about it, if you really get down to this before I jump into the talk about Skunk Works, is the fact if you look at the scheduling, I mean, that whole thing down here in the US and the scheduling is FUBAR, is wrong. And the reason being is, and we looked at this just in December, so it's pretty up to date in the last month or two. 51% of all the compounds, I think there's 602 compounds and entities, let's put it that way, that are scheduled. And the reason why I call it entities is there's three things that are relevant to this conversation. They're Schedule 1 in the US. One's marijuana, spelled with an H. Another one's marijuana extract, spelled with an H. And then the third one is tetrahydrocannabinols. And so, frankly, everything else on these lists, scheduled lists, Trevor, are compounds. Marijuana is not a compound, right? So they really should just deschedule marijuana extracts, and then reschedule tetrahydrocannabinols to Schedule 3. But I don't hear anybody talking about that. But there is inconsistencies in how they do it. But they're getting back to the capital. I mean, we're looking around, couldn't find capital here. You and I've met, yeah, in San Diego, but we've been to Europe. We've talked in Davos, Dubai, Berlin, Frankfurt, certainly in Toronto three times, and Grand Cayman. But the thing is, trying to find capital has always been really tough the last 3 or 4 years. And so Matt Doherty and I, who works with me at Golden Eagle Partners, have been reaching out to a lot of these big companies because we know they're looking at the space, whether it's a Nestle or a 3M or a Dow or a PepsiCo, right, or a L'Oreal, or a Red Bull, right? It goes across all
Yeah.
these spectrums, all these industries, because they see the opportunity with these natural compounds. And the problem is, Trevor, when we reach out to these companies, they're looking at, but they won't admit it publicly due to a lot of the stigmas and the misinformation and everything else. And so we're thinking, well, how do we crack this code? And so last July, we came with an idea. I've read the book, and actually, the book is here. If anybody ever wants to read it, it's a fabulous book called Skunk Works, and it's about the Lockheed plant in Palmdale, California. They came up with some very innovative airframes. Excuse me, the SR-71, 117 Blackbird. Excuse me, not the 117 Blackbird, the Nighthawk, the stealth fighter. And so Skunk Works has become synonymous with secret innovation. So our thought was, okay, we established Skunk Works Nature, and we've also been using AI for over 3 years. So now we are also integrating AI. So Skunk Works Nature AI is this new company, and the idea is to go to these companies and say, hey, you can waste a lot of time and money to try to innovate around these natural compounds, or you can come to us. And if we don't have the answer, which we may not, whether that question is too, whether the question is regulatory, scientific, biological, maybe chemistry, regulation, government, across this whole spectrum, they can come to us. If we don't have the answer, we have this really nice Rolodex we've generated over the last 12 plus years, right? So we can go to those people, and the idea is that we would get paid by these big companies to help them strategize and innovate on these natural compounds, not just cannabinoids, but all kinds of natural compounds.
Yeah, and you shared a little bit of that to me ahead of time, and I mentioned it, but I got to mention again. Growing up, the SR-71 Blackbird was my favorite plane I ever read about. All titanium outer shell, closer to being a spacecraft than it was an airplane. I think some back from the '60s, some of its speed and altitude records still haven't been broken. But I'm glad you brought up the F-117 because I thought that was a nice segue to what you're doing. Is so if everyone can picture the funny looking geometrical stealth fighter with the weird panels. It looks a little bit like a spacecraft. Well, I'd heard recently that the big difference between why it looks all angular and the newer generation, the B2 bomber and some of the F-35s, which are smooth, is computer power. When the F-117 came out, they couldn't do the math to make all the radar reflections smooth, and now they have strong enough computers to do that, which segues nicely into you guys using AI to get more natural products into these big companies, we'll use Red Bull, into a Red Bull product. So I thought that was
Yeah. Well,
another good
what
reason why Skunk Works is a cool name that you picked.
Well, thanks. Well, the other thing, just a little anecdote from this book. One thing that's really interesting is the CIA did set up this fake company because we didn't have all the metals needed to make the SR-71. A lot of
Hmm.
them were in Russia. So the CIA set up a fake company to get actually. So the SR-71s are built with some material, some minerals from Russia, if you can believe that. The other thing
That
that's
is
interesting
very
about that
cool.
is the 117. They got the idea with stealth. There's a Russian scientist who came up with the original idea and wrote a paper on it. Nobody really read it, and the guys at Lockheed found that paper. So Russia has had quite a lot to do with those two airplanes, actually. So, but yeah, I mean, getting back to the compounds, I mean, for example, alkaloids are fascinating, right? I mean, if you know of two more compounds other than caffeine and nicotine that have made more money for mankind going back ages and millennia, let me know. But nicotine's an alkaloid, caffeine's an alkaloid, cocaine is an alkaloid, and also ibogaine and psilocybin and psilocin are alkaloids. So yeah, you have this, and that's kind of what we're trying to do too, is the fact that what we're saying, and you have like gummies. Here's an interesting example where they're trying to put 4 or 5 cannabinoids into a form factor like a gummy or even some of these beverages. And we don't know what a lot of these molecules do by themselves, much less together. And so that's kind of really what we're trying to do with Skunk Works Nature AI is to try to find the science and use biotech and hardcore science and stringent science to really kind of make products that do specific functional things. And that's why you and I continue to talk, Trevor, because that's right up your alley.
Absolutely, and again, we'll keep. It's not a plug for Red Bull, but if Red Bull wants to sponsor this episode, they can. But that was sort of Red Bull's inception. Is they went and found taurine, which is kind of sort of a what we'll call it, a caffeine booster. So and they like taurine. They like the actual picture of a bull, and that is kind of the genesis of where Red Bull came from. So Red Bull using we'll call it natural products in is kind of the invention of the whole company. So you would think this, other alkaloids besides caffeine, possibly in a functional product, a health product, should they shouldn't be the only big company out there interested in doing this kind of thing.
Yeah. Well, and I mean, I've talked to some people too that they're looking at a lot of these compounds too for cosmetics, right? And improvement there. So, and that's the thing. Not to say that we have all the answers, but for example, we know a guy Guillermo Moreno Sanz who's out of Spain. He's an endocannabinoid system expert. There's all kinds of and that's the crazy thing about it. If you think about it, like for example, I mentioned alkaloids. There's phenolics, or there's even polyphenols. There's cannabinoids, certainly, terpenoids, flavonoids, glycosides, all kinds of different compound classes. And so if you think about, the menagerie of natural compounds we have that have potential, it's going to take a lot of money, a lot of years to weed through some of this, pun intended. But
Mhm.
I think we are potentially on the cusp of some interesting things. Like for example, let's take alcohol, right? I mean, a lot of the alcohol companies are freaking out because alcohol consumption's going down, and I think it might be kind of the genesis like we had with cigarettes, right, in the 50s and 60s when people started realizing that smoking wasn't good for you, and I think people are starting to realize that there's better alternatives than alcohol.
Yeah, absolutely. I'm sure it's similar south of the border, but we get reports here that the kids my generation and younger they are literally drinking a whole lot less than my generation did, and some of them are going towards cannabis or other things, but it's just sort of a general thing, a general stigma, a general understanding that alcohol is not good for you. Let's do something else instead. So yeah, it
Yeah.
seems to be a trend.
Well, I mean, another thing to add to that, I'm sure you know what an LD50 is.
Hmm.
And I think I brought this up to actually a doctor a while ago, that LD50 stands for lethal dose 50, which is a way to standardize, the potency or lethality of a compound, right? Like phosgene or something like that, or chlorine. And as you know, ethanol does have, as we see a lot, unfortunately, with like fraternity hazing incidents, right? That alcohol does
Yeah.
have a LD50, but marijuana, or sorry, THC plus, tetrahydrocannabinol does not. So I think there's a lot of interesting thing. And the one thing too, to bring this up just out of the blue, there's a paper that I pulled up and that they did a study of natural compounds versus like synthetic compounds that have run through clinical trials. And it's not rocket science, but it was interesting that they did realize that the toxicity profiles and the success of the natural compounds in toxicity tests were much higher success rates than the other compounds, right? Because they're natural. So natural compounds tend to be safer.
Yeah, my co-host Kirk and I talk about this all the time. Uh, he nicely calls me a bit of a patsy for the pharmaceutical industry because of what I do, but all in good fun. But yeah, it is hard to argue that some of these things that, as you mentioned, have been used for thousands of years, whether or not you think they have beneficial effects, they're definitely less toxic. We have, for some of them, thousands of years of anecdotes of people using them and not dying.
Yeah. Yeah, definitely. So I think, going into this year, well, one interesting anecdote too. We'll see where this goes. I mean, we're still just kind of new and it takes some time to build a business. But, the interesting thing about this is pretty much everybody we've talked to that is, interested in being a part of this, being a consultant, where, essentially we call them up and say, hey, we have these questions. And I should have made it this more clear. Skunk Works Nature, what we'd end up doing is sterilizing our client's name. So if we were to work with a PepsiCo, we're the only ones who are going to know that we're working with PepsiCo. Anybody that's a consultant for us, it's going to be client X or whatever. And so we would go ahead and say, hey, we have these questions. Can you answer these? And I think we'll see. This year should be an interesting year. We'll figure out whether it's gonna it's a business model that works or not. So
And I think that's really interesting and hopefully prescient is, the take a political term, the plausible deniability. There will be big publicly traded companies that, their investors and others, advertisers aren't going to like the fact that, maybe PepsiCo was quote unquote looking into marijuana. But, if they weren't because, a arms distance, Skunk Works was looking into it for them. That kind of gives them plausible deniability while they're looking to see if they want to put this into something.
Yeah. Yeah. Well, and the other thing that I should add too is that in being in these sectors, and you understand it too, for so long, that's the one thing about it too, is that these compounds are different. I mean, that's one of the problems, that and I've heard this before when I talked to one of the guys that used to be one of the higher ups at Aurora a couple weeks back. And, they had a lot of these big P&G companies and stuff come to their facility and talk to them, and none of them wanted to jump in because, oh, it's marijuana, right? But when you get down to it, they're compounds. Now, as we said, scheduling before, like cocaine schedule 2, ketamine schedule 3, all these things are scheduled differently. And, I think there's a way to find really good medicines and things that are healthy for us, and doing good things. And it doesn't have to be scheduled, right? There's a lot of different options, and that's kind of what we're trying to do. So,
Okay. And just before I run out of time, well, obviously you don't, even if you did have a company that's talking to you, you can't tell us about it, but let's pretend I'm a Procter and Gamble, and I really do am interested in making a CBN toothpaste. So CBN, we've talked about on the show before, just meant it's a cannabinoid, and some people are convinced it's really good for helping people sleep. So we want to make a nighttime toothpaste, and we want to put CBN into it. But again, we don't necessarily want to have our scientists looking into it. What would they do if they were sort of kind of thinking about CBN and a toothpaste product? They would call you up, and then what would happen?
yeah, so certainly, yeah, we'd get something in place, certainly over a certain period of time. Um, and then we probably 3 months at the minimum, right, to help them strategize. And the idea is to help them do product development. And the other thing that, luckily for myself, I worked in biotech companies. I was a project manager, so I understand product development cycles. So we can help them on a lot of different fronts. But the idea is, yeah, okay, if it's CBN, it's toothpaste. I mean, we luckily, as you know, when you and I met down at CanMed, we put together these panels at CanMed that include, Ethan Rousseau and Deb Kimless and Deddy Myrie and Hunter Land. That's the thing. So if we don't have the answer, we certainly know some of the preeminent people around the world that can provide, really top-notch answers, especially on CBM. Because, yeah, for example, we have a client. So let's talk about sleep. We have a client. Maybe you do a CBD, CBN, both cannabinoids, because we have a client, Avecho Biotech, that's based out of Melbourne, Australia. They're on a phase 3 trial right now in insomnia with CBD, not CBN.
Okay.
But I do know that I did, connect Hunter Land to the CEO one time, a couple number of years ago, and Hunter Land was like, "Yeah, I think CBN's better for sleep than CBD." Right? So, there's a lot, and this gets down to kind of like biotechnology, right? Instead of just, wetting your finger, sticking in the air, go do the work, do the science, really figure out what these molecules do, what targets they hit, right? And the one last thing to add to this, what's really cool, Trevor, is that the other thing is I worked for a company called Affymetrix back in the 90s, one of the leading genomics companies, and they're certainly one of the first companies to coin the term pharmacogenomics. So,
Okay.
that's the other thing, is that each of us is different in different ways, with, how we respond to medicine and compounds, even caffeine or smoking pot or whatever, right? So
Yeah.
that there's that whole component to it too that we need to weave in.
Yeah, and for those of you who haven't, it's becoming big in pharmacy world. As I said, it's been around for a while, but yeah, they're talking about, could you get a home kit that you could buy in a pharmacy that says, you metabolize caffeine really quickly, so 8 cups of coffee before bed won't affect you, but you metabolize codeine very slowly. So one Tylenol 3, might put you to sleep for the rest of the day. And with a profile like that, it would be easier for us to prescribe to you. Now that's on the pharmaceutical end, but there's going to be the whole separate end on the, we'll call it the natural product side. So yeah, if we could have both a pharmacogenomics profile for someone and match them up to the perfect type of PepsiCo product, that would be ideal.
All right. Yeah, well, there's companies out there. There's Len May is CEO of a company that does a lot of that with genetic profiling and a response to certain compounds, whether it's psilocybin or cannabinoid or any other kind of compound. So there's definitely interesting companies at the forefront of this stuff.
And then the last, because obviously the pharmacology is the most interesting to me, but if I was a company, you guys also have expertise in the, we'll call it the regulatory end too, right? So you can't, you could help them develop the right product, but then different countries, especially the US, there's going to be different loopholes to jump through to get it from a product to a product that can be sold to the public.
Oh, sure. I mean, that's the other thing that's cool about it. We could call on Eric Berlin at Denton's. David Culver, as I'm sure you know, used to be at Canopy Growth. He's a leading lobbyist. Lisa Haug is one of the leading people in Europe, or Kai Friedrich Neumann. He's a leading lawyer over in Daniel Heyman out of Switzerland. Yeah, I mean that you bring up a good point. That's another thing why, we don't have all the answers. Nobody does in this crazy space, but we have the Rolodex and connections to connectivity to get, and again, if these companies want to try to do it on their own, they're going to waste a lot of time and money because we can connect them to the real answers to tough questions very quickly.
Yeah, Skunk Works has the network in place like now to find your answers.
Yeah. And the cool thing is, I mentioned before, pretty much 99% of the people. The only person that I talked to that didn't think it was a good idea was the guy I mentioned, Paul Gavin at Avecho Biotech in Australia, because he's like, well, there's a lot of GW Pharma people running around trying to do the same thing. And I'm like, well, no, this is not just GW Pharma. This is not just biotech. We're across the whole spectrum, right, of questions of whether it's regulatory or even botany, right, for that example. So we'll see what happens. It's great to see you, Trevor, and thanks for having me on. We
Me too. And just my last question I ask everyone at the end because I miss stuff. Was there anything you wished I'd ask? Anything you think the audience needs to know about Skunk Works?
No, one of the questions, and I don't know really what the question is. One of the questions I asked all my guests when we have our GP webinar is what is one quality personal characteristic of yours that you think has helped you be successful? Uh,
Okay, that's a great
and
question. I wish I'd asked that.
and yeah, we get a lot of different answers, but I think mine is probably perseverance. Because that's the thing, like getting back to GEP, right? I think most people probably would have quit. I mean, if you would have told me that, 12 years in, we'd be where we're at with cannabis, which is really nowhere, I would have quit a long time ago. So maybe perseverance and stupidity are probably some of the most endearing
It's hard to
qualities.
tell in the moment which is which.
Exactly.
We're gonna go with perseverance.
Yeah,
Well, thank you,
exactly.
David. It has been lovely catching up. This is very
Yeah.
exciting, and we're hoping to hear more about Skunk Works down the road.
Yeah, maybe we do one near the end of the year and we can revisit and see what's happened or not happened.
That would be fantastic.
Thanks,
Okay, just
Trevor.
hold on the line, and I will hit the stop button there. Yes, I am. Okay, coming back out. Kirk, did you want me to go into our digression on airplanes, or do you want me to leave that alone?
Well, I guess what we should explain is Skunk Works, that term comes from a business organization of aerospace.
Yeah, Lockheed Martin had, maybe still has, a secret, literal secret part that developed fancy secret airplanes for the US government, US Air Force, probably some CIA stuff. There's probably stuff that was done in Skunk Works we still don't know about, but it was like a top secret place that developed top secret stuff. And some of the stuff we do know about is super cool. My favorite is the Blackbird, the SR-71 Blackbird is a plane who literally looked like a spaceship. And as a kid, I remember reading about it, and yeah, some of the like speed and altitude records it set back in the 1960s, as far as I know, are still haven't been broken.
Cool. So he named his new business after Skunk Works for that reason, that it's top secret, or that
Yeah,
particular
that's kind of the
designs.
idea. Yes and yes. So there's all. They figure there is interest out there from some really big companies in the food space, the beverage space, the cosmetic space, who really are interested in getting some natural products into their products, but hesitant, not sure they have the expertise for a variety of reasons, aren't jumping at it. So this would be kind of your secret best friend if you were a Red Bull, and you don't necessarily want all your investors, etc., the public, the media to know that you're looking into getting a natural product into some Red Bull drink. But Skunk Works could, they've got the everything from the pharmacology and botany background to the legal background to give you a good idea if this was worth pursuing, what you could do, what it could do, what you'd have to go through to get it to market legally. So, and they would do this all, like they said, white label. Like it would be as if Red Bull did it on their own. Skunk Works wouldn't ever reveal the companies they did their work for. So sort of an arm's length research company that you could have help you develop some natural products into your existing line, without you having to do all the work yourself.
Yeah, and it's a relatively new company because you go on the internet and their homepage is under construction, and I think this is relatively new, right?
Yes, my understanding, less than a year, Skunk Works has been around for now.
Well, I'm going to tell you what really popped for me in your discussion, and and it's sort of timely for me, Trevor, because I've been listening and doing a lot of studying lately and working deeper into the endocannabinoid system and learning stuff about cannabis and looking at it from medicinal. And ever since we talked to um, Dr. Robinson about diabetes and cannabis, I've been on a real search for how cannabis has truly been stigmatized. And when I listened to your conversation with David, I really believe that this has all been orchestrated, like again, I don't want to sound like a conspiracy theorist here, but when you start looking at cannabis as a global entity, as a global business. I mean, back in Reefer Madness days, the Hearst business, the DuPonts, big business came down on marijuana, spelt it with an H, and got marijuana scheduled as a Scheduled One psychotropic. What is it? It's under Schedule One and is considered a psychotropic drug. And what really popped for me is when David said that, when you look at Schedule One, uh, you start looking at the components, the molecules that have been registered as one. But you start looking at marijuana, spelt with an H, which is purely a reference to the Mexican accent and how marijuana is said. It's purely stigmatized within the government of America. So I thought that popped. And the fact that his global banking firm, Golden Eagles, is one of the last remaining financiers that started in 2018, 2015, when cannabis was the rage and everyone was going to say, well, finally, cannabis will get its due. Cannabis makes paper, but we cut down boreal forests instead of making cannabis out of paper. Cannabis is medicine, but yet big pharmaceutical companies are still what we go to, even in opiate reduction programs. I mean, you and I have discussed this. We've talked to experts, we've talked to people that have done the studies. Cannabis has been shown to decrease the use of opiates in people that use it for prescription, people that use it as a substance of misuse. Cannabis will decrease its use. But yet, even in opiate replacement programs, cannabis isn't listed. It's a list of a whole bunch of pharmaceuticals that have been built in a lab. So that's what popped for me in this conversation is how cannabis is truly thwarted in the banking industry, in big business industry, and in medicine. That's what popped for me.
Yeah, I'm not saying you're wrong about any of that. I don't think it's an organized conspiracy against cannabis. Maybe I'm wrong. Maybe there is some cabal somewhere. I think it's I think it's stigma and momentum.
Okay.
But but but
We're
that
getting
that but
into
that's not
this.
the
We're
but
getting
that's
into
not the okay, fine. But I just before we get into that,
okay.
whether that's true or not, I think it is interesting again, and I used the during the conversation the CBN toothpaste as an example. Now, in different conversations, we talk about the people who want to take out a molecule from cannabis plant and use it in something because it's easier to patent versus people who want to use the whole plant. And I've said before, and I'll say again, I think it's going to end up being somewhere between the single molecule people and the whole plant people is how it's going to end up. Again, wait and see. But I also think it's going to be harder to get cannabis into, or cannabis products and all the other, we mentioned a lot more than just cannabis, natural products into the mainstream without the money behind some of these big companies. So I think this is a very interesting way of getting companies who are reluctant to spend on natural products to spend on natural products because it sort of de-risks it, takes some of the risk out for them. So, and once a PepsiCo has a cannabis based or a natural product based product, then again, it's another step towards destigmatization and just acceptance out there. So I thought this was a really interesting, who knows, might not end up being the right one, but I thought it was a nice, interesting way to take another bite out of getting it into the mainstream.
Well, I sort of agree with what David's doing. He's got to find another angle. But when I want to talk more about this orchestration.
Sure.
Well, we know for sure, right? We know for sure through documentation that in the 1920s, 30s, and 40s, cannabis was stigmatized and it was orchestrated. There's no question that has been documented. How William Hearst went after the cannabis industry, how DuPont went after the cannabis industry, and this all happened because they were in the middle of, owning forests and making paper mills and making synthetic ropes and they replaced cannabis. And today, why I say it's orchestrated is because I've been doing some research on mindfulness, right? And what's happening in Canada right now is that 50% of us are happy. 50% of us are not happy. And this has all been measured. This has all been measured through Health Canada. Statistics Canada has the wellness framework that they use. The 15 years old to the 24-year-olds are the saddest generation out there right now. Like 65% of that generation is considered sad. And when I talk about orchestration, what's very curious about that generation is that that generation is not going towards alcohol as an intoxicant. They are moving to cannabis as an intoxicant. You and I, over the years, and we've been doing this for years, we've talked about the damage alcohol has done compared to the damage that cannabis has done. And without getting deep into it, you've agreed with me that you would have preferred your high school uh, children to have rather indulged in their cannabis use than maybe the alcohol use. Now, for whatever reason, but when that's come out, what is industry doing right now? I mean, very recently, we've had two premiers, Doug Ford in Ontario and Wab Canoe in Manitoba, have a nice little combating is not the word I'm looking for, a little back and forth over Crown Royal alcohol because alcohol creates employment for Ontario and Manitoba. So they've been back and forth. They've been using alcohol as a leverage tool to make Canada whole and shop within Canada. Meanwhile, access to medical cannabis is difficult. The other thing, when you go to the demographic, the sad demographic, who are now going towards cannabis instead of alcohol, what's the thing that CBC radio starts talking about? Strict question. What came out on the news very quickly in the last few weeks? The whole issue of cannabis.
That that more people using cannabis was causing more psychosis in younger people.
Correct. Correct. Now, I don't disagree. I've read that study, but what they fail to say about that study is the variables that are involved. And the variable of that's involved is it's happening to very few children, and it's happening to children that have predisposed factors for mental health issues. They don't talk about any of that. They just basically say that don't use cannabis, it will make you schizophrenic. Now, okay, I'm stretching it, but it's fear. It's fear. Everything about cannabis is fear factor. Meanwhile, cannabis is sitting back here going, I can make you paper, I can make you healthy houses, like I can give you some medicine that's low risk, and we can create businesses. PepsiCo's not going to use cannabis because they can't patent it. Or maybe they want to put THC into Pepsi. My point is that rather than educate people like they did with responsible drinking campaigns, which is probably one of the reasons why the young generation isn't using alcohol, because that campaign worked, why aren't they working on mindful cannabis consumption opposed to using fear? And that's what I'm saying about orchestration. I thoroughly believe that alcohol makes more money, but yet it costs society more. You know, cannabis actually gives society more money. The economic developments of cannabis in our society is actually on the surplus. The economic dollars of alcohol costs us more than alcohol gives us. So why are two premiers fighting over alcohol and ignoring cannabis? I think that's orchestrated. There's stigma.
Fair enough. Fair enough. But back to Skunk Works and getting all the other trying to get big companies interested in natural products. Any other thoughts about that before we wrap this one up?
Yeah, I think one of the problems David is having is how do you patent a plant, right? This is the other thing, is that everything's lumped under cannabis or marijuana opposed to the components. That was the other thing I wanted to mention is that as a biochemist, I liked how he refers to cannabis by compounds and isolates. And
well, I'm going to answer that a little bit because you don't necessarily have to. Because back to one of the examples we talked about, Red Bull, like Red Bull's magic ingredient is taurine. That was sort of, they found taurine plus caffeine, so it gave you a better buzz for a longer period of time. That's simplifying, but close enough. And, taurine, Latin taurus, looks like a bull, which would make the company Red Bull. That was sort of their whole thing. They didn't patent taurine. Kirk Nyquist could make a taurine containing thing tomorrow. So you don't, in pharmaceutical world, you really want that patent. And there are ways, and I'm not an expert, but there are ways of patenting, like how you extract it and some other, it's not, I agree, it's not as straightforward as, in prescription pharmaceutical world, you usually find a molecule, you patent it, you turn it into a medication. You might not be able to patent the cannabinoid or the terpene or the alkaloid, but if you were sort of first to market with it in a soap, a shampoo, a whatever, maybe you don't, and I'm again not an expert, but maybe you don't need to, because there's definitely been examples of, again, taurine, it is in Red Bull first. No one else seems to care that, someone else comes along later and goes, me too. So there's that, and there is patentable stuff around how stuff is extracted. So I still think there's a good business case to be made for some of these bigger companies to get some natural products out there as a competitive advantage.
But it makes you wonder why they haven't done it already.
I'm leaning towards stigma and momentum. There's just not a push to do it. But, let's say, again, I think Red Bull should give me some money for this, but I'm going to keep going back to Red Bull. Let's say Red Bull does come out with the next big thing, and it's got a magic terpene in it that, everybody loves. Don't you think if suddenly Red Bull's market share was pulling away because they had terpene X in it, that PepsiCo would be the next one? And if you got a company sort of on the natural products bandwagon that got a runaway success, I think tons of people would want to be next. So I'm thinking they hopefully FOMO, basically FOMO. If one guy does a real good job, it will bring the rest to the table.
Well, I wish them luck. I hope it happens. Hey, an observation I made watching the hockey game, the Canadian jerseys, I swear to God, the silhouette inside the maple leaf is a sativa leaf. I swear to God, did you look at that?
It, you mentioned that I haven't looked yet, but
It's a sativa leaf.
let's assume that is true. Let's assume there's a cannabis leaf inside the maple leaf, and that's what's going to bring home the gold.
I think so, and maybe break the stigma. Cannabis is a plant, and oh, that was the other thing I was going to say is that we need to separate the plant from the isolate from the components, and that's what I
Yeah,
liked about what he's doing in there. Yeah,
yeah. David mentioned that a few times, and I
yeah,
100% agree. It doesn't make sense to have a plant be in Schedule One. It should
exactly.
be the compounds,
Especially spelt with an
but
H.
especially spelt with an H.
Yeah.
So I think that was another good one. Thank you again, David, for chatting with us. I've been Trevor Schufeld. I'm the pharmacist.
And I'm Kirk Nyquist, registered nurse. We're Reefer Medness, the podcast found at all the socials, reefermed.ca. Give us a rating on your podcast provider so we can get our numbers out there. We've often said Meta does not promote our program. You can find us on social media if a friend finds us, is because you pushed it to them. So yeah, yeah.
All right.
Tell
Have a
others.
good night. Talk to everyone later. Go Canada, go.